Morning, everyone. This is my motivational interviewing um, presentation. I guess I did my paper and this presentation on alcohol use. I guess first of all, I'll be talking about the spirit of MI. I guess there are four components in the spirit of MI: compassion, collaboration, evocation, and acceptance. Um, Compassion entails prioritizing the well-being of clients. That's according to Holman. Collaboration, and what means, I guess, partnering, working with clients in the helping process. Evocation, usually, I mean, that's when a client kind of talks about something and you sort of like clarify, re-articulate those emotions that they're struggling with, so you kind of clarify it. And then acceptance um, entails it's empathy, basically, about understanding what the client says, and then also accepting I guess, that they're the ones who are going to determine their outcomes. Um, I guess I looked at four studies for this paper, basically just compared how MI was used in these four studies. So in the first study was by Patterson and Wolf. Um, they conducted a study on how MI can be used to retain patients in intensive outpatient therapy for people battling alcohol dependence. Um, they had a mix of both male and female, um, I guess, members in this study. It's actually the only study that has a mix of um, both male and females. The rest of the three studies where the population was only females. Um, they had a treatment and a non-treatment group. However, they didn't assign the group and people into groups randomly. Um, they they administered uh, five MI sessions to the treatment groups in 2 weeks. I guess the goal was to see if MI um, would increase the completion of the program, and if also it will lead to people, to participants not dropping out early on um, during the IOP group. Um, they found out that MI did not improve um, participation, participants completing the program or spending more days in the program. However, they did acknowledge that the study did not, I guess, measure like how rigorous they should have implemented um, MI, and it also did not account for possibly other things that were going on in clients' lives that possibly led um, that could have led to them not completing um, the IOP group or spending more days in it. And then the second study I looked at was by Osterman and Diehouse. So their study, I guess, the population was actually um, pregnant women, and this woman had a history of using alcohol in previous pregnancies. Um, it's important. This is an important issue, alcohol in by use by pregnant women, because alcohol use can have adverse effects on babies. One of these effects is the fetal alcohol syndrome. And this fetal alcohol syndrome leads to other difficulties, developmental delays, and the rest. Um, I guess in this um, study, they were looking for if motivational interviewing would lead this pregnant women, to having a changed mindset about using alcohol during pregnancy, and if they would also um, it also lead to like how frequent they used alcohol. Um, the MI, I guess, in their study did not um, change the mindset of women about alcohol use, and then how frequent they used alcohol also did not change. Um, I guess I guess also Osterman and Die House, I guess another thing to um, that they did not account for was, I guess, also how sort of like intensive MI should have been implemented in, I guess, in this study. They didn't, just like the previous study, although the previous one was looking at more like 2 weeks, this one was looking at the after effects. And then I guess going on to the next study by Eman and Gross. Unlike the previous studies, which have been about groups, I guess this particular study was about an individual. Um, wasn't wasn't about a group unlike previous studies. This study was about an individual. I guess this individual had an alcohol disorder. A college student, in particular, this female student had an alcohol disorder, and then I guess her parents gave her conditions to go enroll in this therapy. And in this study with the therapy, we combined both MI. MI was paired with acceptance and commitment therapy, ACT, um, in treating this college student. Um, as with a lot of cases in MI, the client initially was ambivalent and in denial that she had an alcohol problem, was in total denial that she had an alcohol problem. Um, so with MI and then ACT in use, the client eventually, I guess, the client eventually realized that she had an alcohol problem. And also, what MI was doing here was basically to try to help the client realize her values and hope, and if she can realize those values, and then it could be like a motivation for change. um, I guess at the end of the study, the client reported drinking less frequently and having fewer episodes of severe alcohol use. And also, like even after undergoing this first session that was required by her parents, later on the client enrolled again in a longer session on her own, um, without being told by her parents. I guess in this story we can see that MI pairs well with other modalities. In this case, it was the acceptance and commitment therapy. In Holman 2021, the book, he had mentioned that MI pairs well with other modalities. One example was cognitive behavioral therapy. And then the last study I looked at is was Paulson et al. 2022. Um, the population in this one, like the previous two, was um, all women with an alcohol disorder. In this case, however, they used instead of using motivational interviewing, they used what was called intensive motivational interviewing. So what they said was that motivational interviewing usually will require um, 1 to 2 sessions, although I'm not exactly sure how true that is because in the first study I, I looked at MI was done in 5 to 6 sessions. However, IMI requires like at least 9 intensive. It's more intensive because it requires 9 sessions as opposed to the 1 or 2. That's the average of MI. And then at the end of this study, they found that those who were treated with MI reduced their drinking habits significantly, unlike those who were only treated with MI, um, who didn't reduce their drinking habits significantly. So I guess here the non-treatment group was treated with MI, while the treatment group was treated with intensive motivational interviewing. And I guess basically from these 3 studies, from these 4 studies actually, not three, what we can see is that MI was effective when paired with another modality and when uh, employed intensively. Um, I guess some limitations that people have spoken about MI is that it usually doesn't it focuses a little. They say it focuses a little too much on the individual and doesn't focus as much as the person and the environment, which is at the end that NASW might um, describe as maybe treating the person as a whole, just basically looking at other explanations and other surrounding factors that influence the individual. I guess self determination is not all about the single individual. However, um, in most of these studies, the most of I guess at least the first two where they spoke about MI not being successful, you would see that in those cases the researchers acknowledged not considering some of these external factors. I guess this person in environmental factors that could have led to MI not being successful. So I guess basically from the research, one then begins to wonder if the lack of success of MI is more about uh, MI itself or more about in the way that it's implemented. Um, I guess if one uses maybe focusing employs like the person environments, because from a lot of the theories and in the books, you can see that I guess, can be implemented in a way that focuses on the person in environment perspective. So basically, it has to do, I guess, in the way studies are implemented, whether or not MI has that limitation of considering the other factors, and also, I guess, sometimes um, in some studies, I guess they might they might it might just be focused on looking at a specific population. For um, example, in the I guess the Paulson and our one, I don't think it looked mostly at non-Hispanic African American women, and they did acknowledge that they um, they didn't consider that diverse population. Um, However, sometimes I guess for some studies that what the hypothesis might be like a specific population. I guess just for example, this assignment, I mean, we all can sometimes focus on alcohol. At the same time, maybe child abuse and neglect. So sometimes there's still good knowledge in being specific and then being able to be broad at the same time. Thank you.